Hi there, it's Liz Davis here, and I was going to give you a quick rundown of a condition you may or may not have heard of. It's called SIBO, and it's actually incredibly common. Okay, so we're going to go over what it is, what is SIBO, what the symptoms are, how you get it, and how you can effectively treat it if you do have it. Okay, so what happens is most of our bacteria need to be housed in our large intestine. That's where they should live. Sometimes, however, for a number of reasons, they might migrate through to the small intestines, and then while they're there, they start to cause all sorts of icky symptoms like bloating, diarrhea, stomach pain, all the usual suspects. It may also start to cause symptoms outside the digestive system as well. So depression, hormonal issues, and rosacea skin conditions, things like that. So if you've got any kind of stubborn condition that's really getting on your nerves or you just can't shift, it's possibly worth getting this checked out as well. So let's have a look then at, how you might what sort of circumstances might give rise to it. So what happens is, say if you are suffering from IBS or you've had an IBS diagnosis, then you might have something like SIBO hanging on in there as well. So if you're trying to treat IBS, you're not getting anywhere. So you're taking probiotics, that kind of thing, and it's actually making things worse. That's a pretty good sign that you can have some SIBO going on as well, some SIBO. What's going on there is you're taking more probiotics and it's stirring everything up and just making the whole situation worse. So if you've got that going on, that's a pretty good indicator. So aside from that, if you've had any other kind of intestinal or bowel surgery or gallbladder removed, if you're taking antacid medication on a regular basis, or PPIs, that kind of thing, in order to bring down stomach acid levels, that can really break down the defenses in your stomach and allow some bacteria to creep up into the stomach and the small intestine. So any other bowel issue and you're trying to eradicate symptoms, then that can be a good indicator that you've got a bit of SIBO going on in there as well, because it likes to kind of hide behind anything else that you've got happening. So if you've had any kind of disruption like that and you've got all these bloaty, horrible symptoms, then it's a pretty good indicator that SIBO can be to blame. So if you do suspect it, then what do you do? Well, some GPs will refer you for a breath test. A breath test is the kind of best way to test for it. And there's lots of information on breath tests that I can give you. There's kind of one or two options. So if you get in touch, I can give you a rundown of various tests, which will be a lot easier to get hold of privately. It's a simple breath test, taken over a sort of period of hours, and send it off to the lab and they'll come back and say definitely yes or no, which is good. So that will give you the definite answer. And so then once you have the answer, you know what you're dealing with and you can go about treating it. So how do you treat it? It can be a bit tricky to treat because it tends to, the colony of bacteria in the small intestine tend to kind of create a biofilm over the top of itself to protect itself, because it's in like its wrong environment, so it needs to protect itself even more. So it can be quite tricky to break through this biofilm to get the appropriate treatment in there. So the appropriate treatment would be either antibiotics or natural antimicrobials. Would quickly knock that out, just as long as you break down biofilm as well, and there's certain supplements you can take to do that. We could then look at doing a low FODMAP diet just to take the pressure off your gut while it heals, and maybe add some enzymes in as well, just to really treat it very gently while it heals itself. And then go on and repair the gut nicely, give it a good clear out. And once we've done all that, also focus on doing some nice mindfulness techniques like meditation and also exercise as well to really kind of get stress levels under control. Can really help you in this. You know, anything gut related has got a big stress element to it. So if you can get your stress under control, that's really, really going to help loads. Also, the other thing that can happen, if I just backtrack a little bit, if you lose motility in the intestine for whatever reason, then, you know, everything's not pushing through as it should do, then that can give rise to, you know, it gives the bacteria the opportunity to kind of set up shop there and where it shouldn't be. So we can add some nice herbs and things in there as well to get things moving nicely, as well as your exercise will help with that. So ginger's a good herb to use to spice, whatever it is, spice to get things moving nicely as it should do. Okay, so that's a quick rundown then of SIBO, what it is, how it can be hiding in your intestines without you realizing, and what the symptoms are and how you can go about treating it. So if you want to know anything more about SIBO, if you're worried about anything, then do let me know. Book yourself in for a quick appointment in my diary so I can find out more about you. There's a link in the box above. Okay, so until next time, I shall see you soon. Bye.